We start 2017 with a CardioSource World News Interventions cover story on peripheral artery disease. And it follows release just yesterday as we stand here in New Orleans, which you're looking at AHA 2016. And it is the 2016 AHA-ACC guidelines on the management of patients with lower extremity peripheral artery disease. And to discuss the new guidelines, I am with Heather L. Gornik, who is an MD, and you're a medical director of the Non-Invasive Vascular Lab at the Cleveland Clinic. But for our purposes, you're the vice chair of the PAD Guidelines Writing Committee.
Hello.
So first off, thank you very much, because this is obviously a hot topic. This is really a big problem that's just growing in this country, correct?
Yeah, absolutely. I mean, PAD is a disease of the older population. And as the older population continues to expand, so will the prevalence of this disease. So it's actually been estimated that over 200 million people worldwide have PAD, and this will grow. Yeah,
exactly. Well, I mean, I came up with the idea of the cover story even before I knew you were working on this new document. We had done numerous interviews on PAD studies that are appearing in the Jack Family journals, and I thought, wow, this is really interesting. It's time for a cover story, I think. So given that, I think whenever you have new guidelines, the best question to ask is, what's new?
Well, I think there's been a lot new in intervention, so I think it's very apropos that this is for an interventional journal. There's been a lot of development in interventional technologies, drug-coated balloons, drug-eluting stents, etc. So there's a lot of intervention and technology. In medical therapy, there's been some new developments over the past decade or so, but not so much. I mean, it's still fundamentals. It's antiplatelet therapy and statins. I think what's new is hopefully national recognition that exercise therapy can be highly effective for patients with PAD, right. And actually hopefully getting patients with PAD access to exercise for claudication, so perhaps they don't need that drug-eluting stent or drug-coated balloon. So I think those are the new developments.
Are we getting better at encouraging patients to actually get out? Number one, tell them that this is important, because it is, and number two, actually getting them to get up and do something.
Yeah, I mean, I wouldn't put the fault on the patients, because the truth is a lot of times doctors aren't doing a good job with this. Yeah. I mean, there are patients who are in cardiovascular practices who have PAD who may not be aware of it. Maybe their doctor hasn't asked them about leg symptoms or taken off their socks and felt the pulses. So I think the medical community needs to do a better job recognizing this disease. I think we can really work on motivating patients to take medications and participate in exercise. But I think in some ways it often starts with the doc, just recognize the condition and prescribing the treatment.
Now, this is lower extremity PAD, obviously. Do you cover the waterfront in this particular guidelines? I mean, do you start first with the laying out the problem and with the diagnosis and then therapy, et cetera?
Yeah, absolutely. I mean, this guideline document is really meant to cover the whole spectrum of disease. So asymptomatic patients with claudication or atypical leg symptoms, and then the patients with more severe disease, critical limb ischemia and acute limb ischemia. And we take the clinicians really through the whole gamut of care, starting with who are the patients at risk. What should you look for on a history and physical examination to identify patients who might have the PAD? When do you get an ankle brachial index for these patients? When do you need more advanced imaging like duplex, CTA, or MRA? What medical therapies should they be on? And then finally, when should you consider revascularization, endovascular, or surgical?
I mean, we're starting to recognize that it's not just one disease, that it's not all ischemic, and it's not an easy disease to treat, whether you're above the knee or below, which is very different. Is the guidelines going to be able to help in terms of laying out a strategy that will be best for the patient that you're seeing in the office? Yeah,
I think so. I think it's a start. Of course, guidelines are written for a common denominator and a standard that could be applied to a broad population to raise the bar. They're not written for one specific, highly complex patient. That's clinical judgment. But I think it's a great springboard.
This is online now as of yesterday, I believe. And are you already here looking at this meeting going, I wish we had known that when we started this process.
Yeah, we had one. There's been some late-breaking data here at this meeting. There was a trial called the Euclid trial, which was presented as a late breaker yesterday afternoon, which compared clopidogrel and ticagrelor as monotherapy without aspirin for PAD and looked at cardiovascular outcomes and some limb outcomes. And the bottom line is that ticagrelor was not better than clopidogrel, so it was a negative study. So I don't think it will inform immediately the guidelines guideline document.
What I do know is that in the Jack Family Journals, they've had just a wonderful selection of articles on this topic. So I think as we go ahead, this is an area of great interest and one where obviously a lot is happening.
Absolutely, and I know this is for an interventional audience. I just always remind people, most patients with PAD don't need intervention. They need excellent medical care and exercise. So starting with the fundamentals to raise the bar of care for these patients. And that's what we hope this guideline will do.
Yeah.
And then of course intervention when needed, particularly for patients with critical limb ischemia or acute limb ischemia, where delaying intervention and revascularization can actually lead to loss of limb. But that's the minority of patients.
We will make sure that this is used in Cardiosource World News also, which is the
Okay.
general cardiology book, because
terrific.
we got both of them, and it's obviously an area where both sides of cardiology need to have information.
Absolutely.
So I really thank you for your time today.
My pleasure.
And please check around for the new guidelines as well as for our coverage of the AHA meeting for Cardiosource World News and Cardiosource World News Interventions. I'm Rick McGuire.